Hello, I'm Lana Seiler, licensed clinical social worker, and this is Therapy Unboxed. I'm a clinician at All Points North Lodge in Colorado, and I wanted to do this show as an opportunity for people to learn more about terms, concepts, theories, anybody who wants to take a deeper dive in behavioral health. In each episode, I will focus on a behavioral health topic, which will include things like theories, modalities, diagnoses, concepts, and even clinical terms to get a more thorough understanding. I'll usually start the show with some general information on the topics, maybe go over a brief history and some common misconceptions. I really love to learn. I'm not an expert in everything by any means, so I'm super excited to have expert guests on with me from time to time to dive deeper into these topics. I'll wrap up the show with some takeaways and key points. Join me and my expert guests as we unbox therapy from the inside out. So today I'm really excited. We're going to be talking about family systems and systems theory and family systems theory. I have my friend and colleague, Karri Francisco, on with me today. She's the director of the family program here at All Points North Lodge. Karri and I have had the opportunity to work together with a couple of cases, some really challenging ones. And Karri is just incredible. She's super knowledgeable and talented. And one of the things that I'm so impressed with is her ability to conceptualize family systems, which are very complicated and complex, quickly and effectively and thoroughly. So super happy. We're going to have a conversation and dive a little bit deeper and unbox family systems. Before we dive in, I just wanted to welcome you, Karri.
Thanks so much for having me today, Lana.
Absolutely. Thanks for taking the time to hop on. And family systems is really powerful and really important. I have been working in this industry not too long, about 7 years, in residential level of care, and working with the system is one of the most powerful and important things I think we can do for people who are struggling. I think there tends to be a lot of focus on what we call, quote unquote, the identified patient. And my experience is that is only one piece of a puzzle. And to really have quality outcomes and to help people change in a sustainable way and in a deep way, we really do need to sort of look at the rest of the environment and the system that people are in. We have a saying that kind of floats around here and other facilities too, which is nothing happens in a vacuum. And I think that's so true. And whether we're talking about, family of origin or, immediate family, or even, just kind of the different cultural systems that people are involved in, person in environment is really the key. We're social creatures. We've talked about this before on other podcasts. We aren't isolated. We aren't islands. And so getting a sense of what's happening in the system is just enormous. So this topic, I think, is really helpful to talk about more, to get some more information on, more insight. So let's dive in.
I was going to say, though, that I think that you did a great job really connecting the importance of family systems, because I know for me, this was one of the reasons why I chose to be an LMFT, is the family piece and the family system and how that all works together. And that the family system looks past the individual to the relationships as a whole and really does focus on the impact that our relationships, whether they're family members or close friends, do have on us.
Yeah, absolutely. And that's one of the reasons that I chose social work too, is because it is very much about environment and systems and not just on the individual. And I think that gives us, much more insight, and it's a two-way street, and we get to look at how we and our patients respond to others and how they respond to us. So I'm interested to hear a little bit more, right? Because this isn't my area of expertise, so I don't have as much information. I'm interested to learn more about why, what is family systems theory, and why is it important to address that? We touched on it a little bit, but I'm interested to hear more.
So family systems theory really came from the work of Murray Bowen back in the 1960s. He was working with the schizophrenic population, and he started to make this connection that a lot of what was going on was connected with family of origin. So this was not something they were talking about then. And he brought to light multi-generational transmission and how that occurs and the impact that family members, how we're raised, parenting styles, how all of this impacts our mental health moving forward and shows up later in life. So part of family systems theory is really looking not just looking beyond what happens to ourselves, but what impact do we have from our environment? How do we differentiate ourselves, which is how do we find our own identity within this environment? How do we find space outside of just our family network, our friend network, our work network, all the different places that we show up in? And when we're finding that space, what does it tell us about who we are? What does it tell us about the impact these relationships have to us? Another thing that occurs a lot within relationships is emotional cutoffs. At times these things happen, and family systems theory really helps to work to resolve some of those. Why was that going on for you? What was happening in that moment? And addressing the multi-generational transmission is about figuring out what that impact did to you and what way you want to move forward. And what we're able to do from the basis of family systems theory is it opened up many different models of therapy. So I work from a structural family therapist lens, which was with Minuchin from back in around the same time as Bo in the 60s and 70s when he was really developing this model of therapy. And what that really did is it gave space for us to start looking at things not just linear. I think that's the great thing about family systems theory is it takes the linear approach, which we see a lot of time that works really well in individual therapy, and it introduces circular causality. Why are these things happening? And it doesn't matter that it went A, B, C. You really look at it in a circle pattern, and whatever was going on at any given moment has influenced another outcome and how this continues to go on. And what we do as these models of therapy have been created, we look to interrupt the cycle. It's not so much about the relationships are negative or the relationships are bad. These are maladaptive, unhealthy cycles. And we're looking to interrupt those so that you can have better outcomes. You can have better relationships. You can have better connections with your family members. And really looking back on it, when you look at it through a systems lens, everyone's coming in with their own perspective. They have their view of the problem and how they see things. And when you're in individual therapy, you're only seeing from one lens, or you're hearing interpretations from clients of how they think family members view a situation. But when you start working in family therapy and you're using family systems, you're hearing all those perceptions coming in together. And as an unbiased party, as a family therapist, you just get to really sit back and look. And what common theme is that? What are they hearing that's true? What could be misinterpreted because we're not caught up in the same emotion, love, and history? And how much of this is just generational patterns that were passed along to us from our family of origin? So using family systems theory, you get a really rich, not only history, but even currently what's going on for the client. It's everything coming in all together at once with a few of the other outside key players being a part of that conversation too as well, which makes this so exciting to do.
Yeah, there's so much in what you said. Thank you so much. One of the things that I love about working as a team is when, we have a client and like you said, we're getting their perspective and maybe we're doing like a discussion, a case consultation discussion, and family therapy comes in and just rocks the boat with an entirely different perspective. And we're just like, oh my gosh, I would have never gotten that. It would have taken us months and months to get there. And it really just informs how we work with the person and the whole system in such a way that makes the treatment quickly effective. So that's something I really, really appreciate about working with the family therapists. As a team, it's just it's exciting, it's effective, it's so helpful. One of the other things that I was thinking as you were speaking is that most of the time, right, when people seek help, it's because there's a problem, right? So one person or a couple of people within a system have identified that there's a problem and we seek help. And what that looks like oftentimes is fractured relationships. So patients come in and, family members are angry, family members are hurt, family members have distanced. There are a lot of feelings. There's sometimes, deep resentments that go back years and years. There's the tip of the iceberg that we get, and then there's the whole iceberg. Can you speak a little bit to how you conceptualize like a case in a family systems theory perspective?
So I really like the language you just used there of rock the boat, because when we're conceptualizing a case in family therapy, that's exactly a little bit of what we're doing is we need to increase the intensity. So many times family members will come to us, and I understand you're sitting in the room with a therapist for the first time, or you're in their very first virtual Zoom room, and we want to put our best face forward a lot of times. So we're doing our best to hold back on some of the things that we want to share. But the family therapist's job is also to look at what's not being said. Where are they taking that pause? Where are they not looking towards their loved one and highlighting those behavioral interactions? So what I really love about family therapy is you're always doing something. You're always active. You're always highlighting and commenting on, I noticed there that when you made this comment, I noticed that maybe your loved one sat back in the chair and you just had a facial expression to me that seemed like, you were having an emotion or feeling. Can you share that? And it opens the door. So family therapy becomes very active. And when you're conceptualizing a case, you're looking at those pieces. You're looking at behavioral interactions. You're listening to tone of voice. You're observing body language. And I think the difference is when you're with someone individually, you're getting one side to it, but you get to see how other people push them off, how other people make them draw in closer. So a lot of the conceptualization really comes from, as I'm observing these patterns, what am I noticing that is there dismissive language being used? Is someone shutting down? Are there times we're not being truthful and honest? Is that protection to a partner? Is that protection of holding back our feelings and emotions? So as you begin to conceptualize, you're really looking at the system as a whole, about how both people are interacting and showing up, and also how they're not interacting and showing up. So it's almost like a little bit of a mystery of what's going on. And the more you get to know someone, a lot of times what I generally see with families is it's miscommunication that results in a decrease of connection. And when I talk to clients and family members too, we try to come from a place that's not guilt and shame. I know that every person is coming at trying to correct what they see as an imbalance in their relationship from generally a place of love. Sometimes that love, though, can look manipulative. Sometimes it can look dismissive. And highlighting to each person is, I understand this is how you would like to fix the situation with your loved one. But unfortunately, the pattern that you're getting caught in is having the opposite effect. So how do we shift and change that? So a lot of what we do as we conceptualize is we notice the pattern that's going on in the room. And then we highlight that to the family and we explain to them, this is what I see. As you're reaching out for connection, maybe you're using language, but the tone of your voice may sound really forceful. And I see your partner sitting back and shutting down. Did you notice that? So we're really highlighting cues to families, to clients of a lot of it can be broken down into linguistics too. Some simple language changes is really what comes about. But I think part of it is just noticing the part where they get really stuck as you're conceptualizing a case is wherever the family keeps going back to and wherever they keep getting stuck and that small bit of conflict arises between them, that's where the work needs to be done. That's where we see pursuer distancer relationships where one person really needs their needs met. So they come in very quickly and the person that is attempting to meet their needs can feel flooded and they back down. And they don't see that pattern in interaction, but has an unbiased party, we get to see it because we're not caught up in the emotion and we're not feeling hurt or rejection. And sometimes just saying that to clients can be really powerful because it increases their insight.
What I'm hearing is a lot of like maladaptive needs meeting strategies, like noticing those. And then it also sounds like a lot of making the implicit explicit, like pointing out things that people aren't able to see because we're able to see it from the chair that you're sitting in.
I think that's a good way to put it too. And in what we generally call it is you make the covert overt. Whatever it is that they're trying to hide within that room, we shine flashlights. We just shine flashlights on things that it seems like I always hear clients say, it's like, oh my God, have you lived with me forever? How did you get that so quickly? But a lot of times the pattern is just so prevalent because they're so stuck in it and they have such a hard time seeing that for themselves that we're just mirrors. As a family therapist, our job is to come in and just mirror back to clients and their family members. These are your interactions. And then we discuss tools. What are some different tools or strategies you guys can use to come out of this? Because this is the goal that you'd like to work towards.
What are some of the most effective ways to work with family systems? What are the tools that you guys use once these patterns are uncovered and identified and interrupted?
So a lot of the tools that we use when we're working with families, the first is intensity. Once we notice that maladaptive behavior, we need to highlight and increase intensity. That can make clients pretty uncomfortable at times when you're really holding that mirror up in front of their face and saying, here's what I see. Then what we follow with is we model. We model skills to them. Sometimes we step in and we give language and we help sculpt the interactions into healthier patterns. And then we process with families what that felt like, because it's really their input. At the end of the day, whatever language they're going to use, however they're going to incorporate the skill, really needs to be something that's tailored to each one of them. So we utilize intensity, we utilize skill building. A lot of what we do too is a balanced alliance. That's really important in family therapy when you're working with a couple or a family. Is at times we're going to have to say things that are really challenging to either the client or their loved one. And finding a balance of times where I can see the point in what you're saying as the client, but I also see the point in what your loved one is saying, to make sure that they trust us therapeutically and that they don't feel like this is sided towards either one of them. We really structure this as we are the clinicians for your relationship. I'm not just the therapist of what we would call the identified patient, because that puts them into a role of where they feel as if they're carrying all the family's problems, when really every member that's in our room is a part of that system and they are the patient in that moment. And we're really looking to balance how we structure and how we explain to everyone the impact that everyone's behavior has on each other, so that we can move forward together instead of someone feeling like this is something for fault or blame. Because something with family therapy that can be an unintended outcome is if the family therapist sides too much with one person, we create another unhealthy unbalance. So as clinicians, we have to be really aware of what we're doing in the room. And we also have to be really aware of how we're explaining things to clients and their family members, so that we are creating balance and fairness too within their relationships.
So interesting. So a balanced alliance is a new term for me. I haven't heard it said in that way exactly. So what you're referring to is, correct me if I'm wrong, but the whole everybody understanding that you're there as a person for the relationship, not for any side, quote unquote, particularly. Is that what that means?
Yeah, because when you really think about it, one of the analogies we give is, are you teammates or are you on different teams? Like, are you trying to score a point against your loved one? And what do you win? Like, it's really, I think when you think of the family therapist, you think of them almost as a coach. How are we getting you to come together as a team and work efficiently with one another? And it's also the outcomes that you want to as well, because no one wants to be a part of a family or in a relationship where you're on two opposite teams keeping score with one another. That doesn't ever turn out well. You want to create a sense where the family or the couple are team members. If you win, I win.
Yeah, I hear that a lot from our side, right? In working with the patient, I hear a lot of, I'm afraid to do this because I'm afraid the family therapist is going to side with my wife or my parents. And some of that comes from a place of feeling shame, which I heard you say that, one of the things that you really work to do is reduce that and come from a place of understanding and non-shaming. But people they carry a lot of shame. They bring a lot of shame in a lot of the time. And even from family members, I've heard, when I've had conversations with them before they start family therapy, I'm afraid to do this because I'm afraid that, my so-and-so is going to blame everything on me, or it's going to go back to, years ago when I did this thing or that thing. So that's a lot of the apprehension that I hear.
Yeah, and I think one of the ways that we always try to come and combat that is, something that even comes from narrative therapy, changing the language. We're not here because anyone's the problem. The problem is whatever the maladaptive pattern is. Is it addiction? That's the problem right now that's coming in between your relationship. Is it a miscommunication? Is it unhealthy connection styles that we're coming across? So we really take the language and we focus it onto what the identified problem is, whether it's, something of a misaligned attachment. We need to work towards more secure attachments, some relational distress that's coming up, and conflict. The conflict is the problem, not the two of you as a couple, not mom, dad, and our son or daughter. Maybe it's just the conflict that's coming into this. And if the conflict wasn't here, what would your relationship look like? So we really need to, in family therapy, pull it away from the identification of self. We really need to take it away from, we identify this conflict and this miscommunication and this misalignment that we're having within our relationship has attached to us as ourselves. It's a pattern that we've all got stuck into. We all play a role in it. And we're all influencing and impacting keeping this pattern going, even if it's unintentional. A lot of times what I see with clients, and something I say to them too as well, is a lot of it seems like it's just subconscious. These are just reactions that you've learned over time. It will take us a little bit of time to get out of those, but everyone can get caught in a cycle. Even myself, as a trained therapist in family systems theory, I don't fully always get along really well in all of my relationships with my family.
Get
There's
out of
times
here.
oh yeah, of course. But I think I think there's a part of actually saying that that makes us human to our clients too as well. There's times I've lost my temper and I've raised my voice at my child, but it also gives me this really great experience to come back to him and apologize and to show them that, we do make mistakes too as well. I can understand this system and I can know so many interventions, but sometimes my emotions are going to get the best of me too as well. But repair is big in family therapy. How do we do a repair? How do we do one in a way that is not blaming towards one another, but takes accountability? I would need to take accountability for my actions in that moment if I lose my temper at my child because my emotions were too high. I shouldn't have done that. That wasn't fair of me. I acknowledge that my behavior in that moment wasn't appropriate. And next time I will try and tell them what skill I'll try to incorporate next time and ask for their feedback too as well. So those are the things that we attempt to do within family therapy. And the great thing is, like, when you're in a family therapy session, the more people you have in the room, the conflict's not going to stay bottled up. It's going to come to the surface in some way. And it gives you a chance to work on it right there within the moment. So it's that experiential learning we're creating, and that we're practicing these things in session. And every time our clinicians jump in and they interrupt a maladaptive pattern, we're creating insight. We're creating insight around how that pattern shows up, what feelings we might be having in our bodies, because I know that you are really familiar with the somatic responses, but that's a lot of times our body's first, like, early warning trigger sign if something's about to happen. And connecting clients and families to that in the moment, that is really powerful too as well.
So powerful. So powerful. All of that. What are some of the biggest challenges that you run into when working with families?
Some of the biggest challenges are not wanting to let go of shame and guilt, feeling like, that somebody does need to be at fault sometimes. It's breaking through that pattern that can be really difficult. And sometimes it's, the conflict, having three people in a room. When conflict arises and you're trying to utilize interruption, but they really need to get something out, that can be a struggle sometimes to contain all of it. But you have to be really mindful as a clinician in your approach of where you incorporate interruption, where you incorporate raising intensity, because they are going to feed off of one another. So that can make the work sometimes difficult, but it also makes the work really rewarding too as well. And I think sometimes it's just, overcoming the multi-generational transmission, the family of origin issues. Some of that takes a long time to really dig through. And something that has been said through research is it takes 3 generations to come out of multi-generational trauma. So a lot of times what we see here is when clients are coming to us, they may be the first generation that's starting to work on something. So we'll know we'll attempt to get to a healthier pattern of functioning. But it's also, I think, sometimes what's difficult for family therapists and individual therapists too as well. I'm sure you'll probably connect a little bit to this, is sometimes we have to let go of the scenario in our head. We can sit with a client and family and think like, wow, a little bit more work and we can really get to this place. But some of them are coming out of family origin issues that have been going on for so many generations that sometimes we have to, as therapists, accept healthier. healthier outcomes, that this is a healthier pattern of functioning for them, and they'll get to their next step when they're ready. And I think for me, sometimes that can be difficult as a clinician to sort of let go of my own ego, maybe a little bit of the work that I can do, let go of my own connection, because I become a part of the system too as well for the time I'm working within it. I'm a trusted member of their family within that moment. And so making sure that you come out of it unbiased and really reflecting on yourself and your own self of therapist piece, that I think can sometimes be a struggle within family therapy, because it's easy to get caught up in what's going on and to be really invested. And it takes a lot of self-reflection, supervision, connecting with other colleagues to make sure that we're really doing what the family wants. What is the benefit they want to get to? Even if I think it could be a little bit more, letting a little bit go of my ego piece too as well. And I think that's something for all clinicians that we can struggle with at times.
I can relate to that so much. And it comes from a place of, of course, partially ego, right? Like, we know that this is possible. We've seen it before. We know the theory. We know how to get there. And some of it is this place of just really wanting that for the client and the families, because we do get to know them and we do care about them and about what we do. And so there's so many times where I'm seeing this goal for this person and having to like really rein it back and look at incremental movement through stages of change, and that it doesn't always happen right in front of us. Sometimes we plant the seeds, or we start a process that then continues and maybe comes to more fruition in outpatient therapy or with, a different therapist or situation. So I can relate to that tons. I'm hearing lots of use of self and awareness of self. We do bring ourselves as therapists into the environment. Like, we can't help it. We just do. And so being aware of our own stuff, being aware of what comes up for us, even listening to our own bodies. And then, that piece of consultation and supervision and a place to bring all of that so that we can, incorporate maybe healthy transference and countertransference, or helpful transference and countertransference, and making sure that we're not, sort of like getting too many blind spots because of where we're coming from, right? Do you guys, maybe this is another question that might be helpful to open up. How do you use transference and countertransference in a family systems theory?
Yeah, so use of self it's up to the therapist. Like, what is your comfort level about what you choose to share? I'm really mindful of the pieces of my personal life that I choose to share with my clients. But when you're making a decision in the therapy room of whether you're going to utilize a piece of self, and it could be as little, so a piece of self that's easy to utilize is, I'm having this feeling right now, right? So when a client's acting in a certain way and I'm starting to have a somatic response, I'll say that to them. Wait a minute, guys, hold on. Like, I'm feeling tension. Like, I can tell you right now, my chest is tightening up. That's my sign that there's conflict coming. Are you guys feeling it? Like, I'm noticing this behavior, and this is causing me to, have a moment where maybe I'm sitting back in my chair a little bit because I'm hesitant to say something right now. Did you realize you have that effect on people? So that's a really good use of self that we can utilize a lot. The other is where we share parts of maybe our personal story of a connection we have to something they're talking about. And one of the things that I've learned from one of my mentors was like, are you doing it for you, for your own personal growth, or does this actually help your client within the treatment plan? Are you sharing something with them to help them get over a hurdle they can't get over by themselves? And that's something like I will sit with. Sometimes I'll have a feeling, and sometimes a client will say something that resonates really close to my personal story. And I'm like, maybe I share this with them a little bit. Maybe I share this with them because sometimes it's a chance to model, like, we do come out of difficult things. We can still be successful after difficult things. We still heal after difficult things. But there really is this piece of, maybe I don't say it in the moment. Maybe I need to slow down and I need to reflect. If I can't tell in that moment if it's for them or for me, I'll talk to a colleague. What do you think about this? Is this something that might be useful? Here's their treatment plan. Here's the goals we are working on. And if it's another clinician who happens to be working with them, do you think hearing this would be helpful for them? If it winds up being about them, then it's my comfort level. This is my personal life and my story. Am I open to sharing this with you? And I think that's the piece of it too. There is no black and white line. Therapy, what I love about therapy so much is we are a mixture of science and art.
Yes, we are.
We play in the gray in this beautiful way that I absolutely love. So I think that's the piece too, is we almost have to be artistic in our approach, but we also have to be scientific too as well. Is this my benefit to help me grow? Because that's not appropriate. I can get my own therapy, or is this their benefit to help them grow? So I think that's one of the pieces that I find like the self piece comes in so much. It's not an easy determination to make, and you have to become skilled at it and get a lot of supervision around it to be able to utilize it in an appropriate way.
So well said. And I think that, and that obviously applies to therapy and on the whole spectrum, right? Whoever we're working with, children, adults, families, substance use, mental health. That's the, like, one of the core foundational pieces of what we do is that it's not a hard science. I say that all the time. It's a blend. And we are a tool as therapists, ourselves, our bodies, our experiences. We're a tool that we can use, but we have to use it really carefully.
I think one of the things too about family therapy is we're meant to be episodic. And I love that. 3 or 6 months is really the time frame of almost every model of therapy that we should be working with. And the reason for that is we don't ever want to be crutches to our clients. We don't want our clients to think that any of this is because of us. I think I'm pretty good at my job. I think we have a lot of really great clinicians out here too as well that are really good at their jobs. But at the same time, you can connect with someone else too as well. This is the work that you're doing as a family is something we always highlight to them. Yes, the therapeutic connection is important, but I think the biggest piece too is letting our clients know, like, you can do this, even if you take a break from me. And with marriage and family therapy, we're meant to take a break so family members and clients can go into the world and test the skills. And if at any time, if they're feeling stressed again or overwhelmed or conflict comes back, you come back to us. And I think that's the beautiful part about family systems theory too, as well. We're not meant to be a long-term therapy. We don't need to stay with us for years. And depending on the therapy model that you're working with too, is sometimes insight is really what you're looking for in that therapeutic model. Sometimes within the therapeutic model, it's that experiential process. It's really a balancing act of the best of two, of how those are coming together and how they benefit the family too as well.
Yeah, so true. That idea of not creating and forming that dependence, but creating and forming sense of self-efficacy and personal agency and effectiveness within the system. Yeah, huge. So I'm thinking about sort of wrap-ups, takeaways. One of the things I'm wondering as I'm hearing you talk is, what are some things that we can look for? Maybe what are some signs that family work might be a good idea within a system? When do we get to that point where we should probably consult a professional? What does it look like?
I always say, when is it not a good time? Well, because one of the things too that I say to clients and families is family therapy is not about finding the problem. Sometimes there are maladaptive behaviors that we do need to correct, but sometimes family therapy is really good to come in and strengthen things that are already strong. So, but what I would say to clients, like, if you feel like you're struggling, and especially if you're in individual therapy and you're starting to notice that there's roots of this that are multi-generational, family of origin issues, if your family members are willing and open to participate in therapy with you, it can help you meet your goals individually so much faster if you can include them.
And what are some of the things that we should look for in a family therapist? Are there any tips that you have for finding the right fit or the right model?
I always say interview your therapist. I think a lot of times we kind of know what we're looking for, and generally every therapist will give you that one phone call consultation. See if you fit. Like, if you need humor, let them know that. If you need them to really clearly define terminology to you, let them know that. If there's something that's not working, or if you don't feel comfortable in that first phone call sharing something with them, are you going to feel comfortable when you get to know them a little bit more? I think part of it really is the fit, but there are many evidence-based models. So if you're struggling as a couple, EFT, emotionally focused therapy, is a great place to go. Gottman trained therapy is a very good place to go. If you're coming with a family, personally for myself, I love structural family therapy, especially when you have younger children. It really helps define hierarchy and goals. I think there's a piece too where don't be afraid to challenge your therapist. Ask them what their training is. Ask them if they've worked with clients who are experiencing the problems you're maybe experiencing within your family relations. Is it something that they consider their expertise? And if it's not, it's okay to move on to the next one too and try to find someone that feels like a good fit for you, because the most important part for all families is you're never going to all enjoy your family therapist at the same time. I'm sure you're going to get upset with them at some point because they're going to challenge you, but you need to feel like you can be in an open, honest space and that you're feeling heard by them.
Yeah, that's a little bit more of that gray that you were referring to before, where we aren't looking at things in black or white terms. And there's a balance, right? We're feeling comfortable enough with this person, but also knowing that there are going to be times where it's challenging and you're frustrated with them because they're shining a light or holding up a mirror.
Yeah, I think one of the other things to know too about family therapy is, I don't know if you've heard the terminology equifinality. So what that means is everyone can start off at the same starting point and take multiple different paths to get to the same goal. So when we think about that, just because I happen to have this attachment to structural family therapy, maybe you need solution-based. It doesn't mean that one is better than the other. With equifinality, it just means that we can all start from the same place. We can all take different paths to get to the same goal too as well. And there's nothing wrong with that. And if you're not sure what you're looking for, it's keep trying different things on till it fits. But if you also know that you're someone that's not going to want to go too much into the past that hasn't been helpful for you, maybe solution-based therapy is where you want to go, where we really focus in the present. I think you should be really comfortable to ask any therapist, what modality do you work from? How would this benefit what I'm telling you that I'd like changed? And here's some things about me I want you to know. Does that line up with your model of therapy? So I always tell them, interview your therapist. Like, I think a lot of times clients are calling us and they think that we're interviewing them to decide if we want to work with them. And it's like, I want to just tell you whether or not I think this is within my area expertise. And if it's not, hopefully I'll have a colleague that it is. But you should be interviewing me and getting all of your questions asked too as well. And, any therapist that's really good at their job should be able to explain to you how they work at it.
Yep, exactly. So helpful. Thank you so much. This has been incredible. I've learned a ton. Thank you so much again for taking some time to come on and speak with me this morning. I'd love to do another one with you, diving deeper, even deeper into some of these different things that we brought up today. But for now, thank you so much.
Of course, always a pleasure speaking with you.
Thank you so much, Karri, for being on the show. It was really incredible, such a rich learning experience, and I can't wait to do another one. Thanks for listening to Therapy Unboxed with me, Lana Seiler. Subscribe and tune in each week for new episodes. For more information and resources, check out apn.com/podcasts. For questions about the show or anything we talked about, email us at pod@apnlodge.com. That's POD@apnlodge.com.